Live from Fargo and serving you on TV, online, and on the go. This is Valley News Live at 6.
We begin tonight with breaking news as Kelby Krabbenhoft is out at Sanford Health. We just got word that the Board of Trustees has announced that the Sanford Health and the longtime CEO have mutually agreed to part ways. Krabbenhoft assumed the role of president and CEO back in 1996. He sent an email to employees last Wednesday indicating that he wouldn't wear a mask because he considered it a symbolic gesture. Krabbenhoft had caught COVID-19 and considered himself immune. There's more to this story on our website, valleynewslive.com, and the VNL News app. The number of people flying out of Fargo is down. Hector Airport saying that the drop is 50% from a year ago at this time. They say it seems like many people are planning to travel this holiday season, but that's not the case. Valley News Team's Bailey Hurley caught up with a few travelers this week and local health experts on how to stay safe this Thanksgiving weekend.
For UND freshman Jackson Whybright, this will be his first time back home in Utah since July, saying he wasn't that nervous when booking his holiday travel plans.
I got a grandpa, he's getting in his 80s, but obviously I'm taking precaution. I'm doing all right, so I'm not too afraid of coronavirus.
Whybright says he thinks he contracted COVID late last winter, but isn't totally sure.
If you've already got it, and it's not too crazy for you personally or your family, then I don't think it's too much.
And many travelers tell me the same, saying they're gathering with family this week because they've already had COVID and say they no longer pose a health risk. But one local epidemiologist says that's not totally true.
We have seen cases of reinfection in North Dakota.
The CDC states a COVID survivor is likely immune for 90 days. But Niesemeyer points out a lot is still unknown about the virus. And he says even if your entire family has already had COVID, that doesn't mean you're in the clear for all the other illnesses you could pass to one another.
We don't know how your immune system will react if you are exposed to flu. Are you more susceptible to other things that the average person could get over pretty quickly, but since you had COVID, it makes you sicker?
Niesemeyer once again urging North Dakotans to keep Thanksgiving just between you and your nuclear family. In Fargo, Bailey Hurley, Valley News Live.
North Dakota's health department is also urging patience for those waiting for a COVID-19 test result, as testing labs have a slight backlog. Some tell Valley News Live that they've waited 5 days before finally getting their results.
We would hate for someone to go to your grandparents or travel over the holiday thinking that you're negative, but then when you're at your family gathering on Thursday, get that result that you are actually positive.
Health experts remind you to isolate until you get your official results, saying no news doesn't necessarily mean good news. Temps warmed to around the freezing mark this afternoon, which is okay for many of us, though. The holiday break is on the doorstep. In Hutch, will we have some decent weather for this break?
Yeah, we sure will. Tonight, we do have a couple of concerns. The wet weather has exited the region. Temperatures are falling, so we could have some slippery roads and sidewalks as most of the precipitation moves well out to the east. Temperatures are warmest east, where we have a southerly flow, but we're cooling into the teens already in the Devils Lake area. Here's a look at those wind speeds. Nothing too strong, about 15 miles per hour from the northwest now, starting to try to dry things out. But fog, a problem. Reduced visibilities under a mile at times in central Minnesota. That'll be the big concern tonight. Slippery roads and some areas of fog across Minnesota. Temperatures slowly falling tonight in the FM area to less than 30, so we could have some slippery spots. We do have some details on the forecast ahead, Mike, as we head toward the big holiday, and I'll have details on the weekend as well here in just a couple of minutes.
All right, thanks so much. We found out today that Sanford Health has been working with the government on plans once a COVID-19 vaccine makes its way to the Red River Valley. Although Dr. Doug Griffin couldn't share specifics on a distribution plan, he did say there's a lot to consider.
But we are prepared. We've been doing exercises to make sure we have the workflow given or ready to go. We have acquired the necessary storage capacity. If you know, the first 2 vaccines need to be stored prior to their deployment at very, very cold temperatures, so they require special refrigeration. So we did have anticipated that and acquired that capacity a while ago.
Dr. Griffin adds that the hospital is still working out exactly how many vaccines would be coming to our area. Meanwhile, Sanford is adding 14 new patient rooms and a support space on the northwest wing of the 8th floor of the Sanford Medical Center in Fargo. This new unit began caring for patients last Friday. Since the beginning of the pandemic, Sanford Health says that they've added 172 total beds to meet the demand for hospital care. Another 25 beds are expected to be added in December. Minnesota's major hospitals and healthcare systems are stepping up their urgency ahead of Thanksgiving. Reporter David Schumann shows us the campaign that declares there's no more time to be Minnesota nice.
Healthcare professionals, from shift nurses to executives, are desperate right now to capture Minnesota's attention. Cue the new Fight COVID campaign.
We need to pull this lever, which is a little bit more in your face.
One of the first two posters, "We're your last chance." And is grandma's pumpkin pie really to die for?
I think it's time to get pretty aggressive.
These doctors who live the situation every day have many facts or numbers to convey the urgency, like the dangerous lack of staffing right now.
Last week, almost 7,000 hospital healthcare workers were out on one day. That limits our capacity to care for hospitalized patients, both COVID and not COVID.
But Dr. Andrew Olson with mHealth Fairview feels stories are more effective than statistics.
My dad is quite ill with cancer, and we're not getting together for Thanksgiving this year. And that's heartbreaking. But to see my dad step up and say, you know what, it's not the right choice this year, guys, gives me great hope for the state.
The medical professionals I talked to didn't give me all doom and gloom. Why? It's because of the people here.
I would rather be in no other state than Minnesota with the tenacity.
We need every Minnesotan to show the grit and the resolve that we know Minnesotans have.
And if more and more people are following the rules, I think that more and more people will follow the rules.
David Schumann, WCCO 4 News.
One of those doctors said, as bad as things may look right now, it's not a foregone conclusion this will be a disaster. He says we have the power to stop the pandemic. The Jamestown Regional Medical Center has a new COVID-fighting robot, and they would like your name or help to name it. The hospital says that the robot is 99.9% effective in enhancing cleanliness by destroying hard-to-kill superbugs. You have until December 4th to submit name suggestions, and you can find a link to do that on our website at valleynewslive.com. Later on Valley News Live at 6, Minnesota's governor has some ideas to help out businesses impacted during the shutdown.
And a look at our soupy day here in the Valley that started out with some cold November rain. We'll have details on what you can expect as we head towards Thanksgiving. A couple of flakes of snow are in the forecast. I'll tell you where and when right after this.